Cardiovascular system, part 2. Atropine is an antagonist of muscarinic acetylcholine receptor. The uses will be symptomatic bradycardia. You give IV atropine first line for bradycardia. We also use for OPP, but no longer routinely used in ACLS guidelines. It can cause tachycardia and mydriasis. Beta blocker indication is in angina, post myocardial infarction, heart failure, arrhythmia, rate control, drug of choice in atrial fibrillation, hypertension, thyrotoxic drug, toxicosis, then migraine prophylaxis we use in anxiety. What are the side effects of beta blocker? It causes bronchospasm, cold peripheries, fatigue, sleep disturbances, nightmares, erectile dysfunction. Contraindicated incontinence, heart, asthmatic sinus syndrome. In verapamil use may precipitate severe bradycardia. Bivalirudin, reversible direct thrombin inhibitor. Dabigatran is an oral anticoagulant of direct thrombin inhibitor. Doesn't require monitoring. What are the indication of dabigatran? We use it for prophylaxis of VTE post-surgery, to prevent stroke in patients with non-valvular atrial fibrillation who have increased or one or more risk factor such as previous stroke, transient ischemic attack, systemic embolus. If the left ventricular ejection fraction is less than 40%, NYHA more than or equal to 2, age more than or equal to 75. If the patient is more than 65, in case of diabetes, CAD and hypertension. What are the side effects of dabigatran? Hemorrhage, decreases the dose in CKD. Especially you have to decrease it when the creatinine clearance is less than 30 per minute. Reversing, you have to use idarucizumab, contraindicated in prosthetic heart valve. Then we have diparadomol, which is mainly used in combination with aspirin after ischemic stroke in transient ischemic attack. Mechanism of action is it inhibits the phosphodiesterase inhibitors. It increases the cyclic AMP levels, decreases intracellular calcium levels. It decreases the cell uptake of adenosine and inhibits the thromboxane synthase. It increases the effects of adenosine. GP2B3A receptor antagonist, apixaban, eptifibatide, and tirofiban. So these three are those GP2B3A receptor antagonist. Hydralazine, it increases the cyclic GMP, smooth muscle relaxant in arterioles more than veins. Indication, hypertension in pregnancy, severe hypertension. Contraindicated in SLE, ischemic heart disease, cardiovascular disease. Adverse effect is tachycardia, palpitation, flushing, fluid retention, headache, drug-induced lupus. Ivabradine, it is an anti-anginal drug which reduces the heart rate. It acts on the funny channels in the SA node, decreases the cardiac pacemaker activity. Now, adverse effect, visual effects, luminous phenomena can be seen, headache, bradycardia, and heart failure. Loop diuretics it inhibits the sodium potassium chloride co-transporter in thick ascending loop of Henle, and it decreases the absorption of sodium channel. Now, loop diuretics work on apical membrane, must be filtered into the tubules by glomerulus before they can have an effect. Therefore, patients with poor renal function, escalating dose to ensure sufficient dose concentration. So I'll just read this again. Now, how do loop diuretics work? They work on the apical membrane. So this must be filtered into the tubules by glomerulus before they can have an effect. So therefore, patients with poor renal function, escalate the dose to ensure sufficient dose concentration. They have to be filtered to reach that place. What are the indication of loop diuretics? We use it in heart failure, both in acute and chronic. Chronic we will use oral, acute IV. In case of resistant hypertension, what are the adverse effects? It can cause hypotension, hyponatremia, hypokalemia, hypomagnesemia, hypochloremic alkalosis, ototoxicity. It decreases the calcium. It causes renal impairment from dehydration. It has this direct toxic effect. It increases the glycemia and gout. Nicorandil vasodilator, ठीक है, treatment of angina, potassium channel activator, and through positive guanylyl cyclase, it increases the cyclic GMP. Adverse effect, it causes headache, flushing, skin and mucosal eye ulceration. It can cause ulceration anywhere from the anal to oral to anal ulceration anywhere in the GIT tract. Contraindicated in left ventricular failure. Thiazide diuretics, what they do? They block the sodium chloride symporter in the DCT. So they decrease the sodium absorption. They also decrease the platelet, causing granulocytosis. They are photosensitivity. They cause pancreatitis. So more sodium in collecting duct is seen. There will be hyponatremia, hypokalemia, hypercalcemia, and eventually gout. It also causes impaired glucose tolerance and impotence. What are the adverse effects? There will be dehydration and postural hypotension. Nicotinic acid, this is niacin, treatment hyperlipidemia. It decreases the cholesterol and triglyceride concentration, increases the HDL level. Adverse effect, flushing mediated by the prostaglandins, impaired glucose tolerance, myositis. Nitrates, these are vasodilator, mechanism of action, release of nitric oxide in smooth muscles, activating guanylate cyclase. So what this does, it acts on the GTP and cyclic GMP, decreases the intracellular calcium level. Okay? In angina, they both cause dilatation of coronary arteries, decreases the venous return, decreases left ventricular work, and decreases myocardial demand. Adverse effect, side effect is hypotension, tachycardia, headaches and flushing. Nitrate tolerance, second dose of isosorbide mononitrate after 8 hours rather than after 12 hours in case of nitrate tolerance. Statin, it inhibits HMG-CoA reductase. This is the rate limiting enzyme in liver cholesterol synthesis. Adverse effect is myopathy, especially in the old female, which decreases the BMI and causes multi-system disorder. Most commonly, it is lipophilic, simvastatin, atorvastatin. It is hydrophilic. Less hydrophilic are rosuvastatin, pravastatin and fluvastatin. So these are preferred. These are hydrophilic. Liver impairment, you have to check LFTs at baseline and at 3 months and 12 months. You have to stop treatment if the serum transaminase are 3 times the upper limit. Third, increase in the risk of intracranial hemorrhage, you have to avoid statins. Contraindicated macrolides like erythromycin and clarithromycin and pregnancy. Indication CVD, stroke, TIA, ischemic heart disease and PAD. 10-year CVS risk of more than 10%. Type 2 diabetes, Q risk 2. Type 1 diabetes is more than 10 years. Age more than 40 and nephropathy. ठीक है. Should be taken at night because majority of the cholesterol synthesis takes place at night. Atorvastatin 20 mg for primary prevention. You have to increase the dose if non-HDL has not reduced by more than or equal to 40%. ठीक है. Atorvastatin you give 80 mg for secondary prevention. Warfarin is an oral anticoagulant. Mechanism of action, it inhibits the epoxide reductase, preventing the reduction of vitamin K to its active hydroquinone form. Cofactor in coaboxylation of clotting factor 2, 7, 9, 10 and protein C. Inhibitor indication mechanical heart valves. The target INR depends on the valve type. Mitral valves generally require higher INR. Second line DUACs, venous thromboembolism, INR 2.5, and if it is recurrent then 3.5 is the target. In case of atrial fibrillation, the INR is 2.5. How will you monitor INR? Patient PT upon normal PT, that is the international normalized ratio. Long T half stable INR may take several days. Potentiate warfarin, liver disease, P450 enzyme inhibitors like we have already seen amiodarone will potentiate its effect. Ciprofloxacin, important is cranberry juice. Drugs which displace warfarin from plasma like NSAIDs inhibits platelet function and NSAIDs. Side effect hemorrhage, teratogenic, can be used when breastfeeding. Skin necrosis, warfarin first started. Biosynthesis, protein C inhibition, temporary procoagulant, purple toes it can cause. Emergency surgery on warfarin. If surgery can wait 6 to 8 hours, then you give 5 mg of vitamin K. Can't wait 25 to 50 units per kg, 4-factor prothrombin complex, and stop warfarin before surgery. Management of high INR. This is a very common question. If there is major bleeding, you have to stop warfarin, give IV vitamin K 5 mg and prothrombin complex concentrate. Now, if the INR is more than 8 and there is minor bleeding, you stop it, give vitamin K around 1 to 3 mg. You can repeat the dose of vitamin K if INR is still high after 24 hours. You can start warfarin when INR is less than 5. Okay, so what we do is that if the INR is more than 8 and there is minor bleeding, you stop warfarin and you give IV vitamin K 1 to 3 mg and then repeat dose of vitamin K. If the INR is still high after 24 hours, you restart warfarin when the INR is less than, up till when the INR is less than 5. If the INR is 8, more than 8, no bleeding, stop, give vitamin K 1 to 5 mg. If prep or IV prep or orally, repeat dose if INR is increased after 2 hours and restart if it is less than 5. If it is 5 to 8 and there is minor bleeding, you stop warfarin, give vitamin K, the same thing. If it is 5 to 8, no bleeding, you give 1 or 2 doses of warfarin and then decrease subsequent maintenance doses. So this is important.